Thanks for tuning in to Health Professional Radio. I'm your host, Neal Howard. Our guest is returning to speak with us, Dr. Frankie Ann Holmes. She's going to talk a little bit more about the recently approved, FDA-approved drug NERLYNX for treatment of early-stage cancer. Welcome back to the program, Dr. Holmes. Glad to have you back.
Thank you for asking me.
You know, we were here before. We talked about the FDA approval of NERLYNX for treatment for early-stage HER2 positive breast cancer. Let's, for our listeners who may not be familiar with that approval, talk about NERLYNX and why it's important that this drug has been approved.
So NERLYNX offers our patients another option for treating HER2-positive breast cancer. HER2-positive is only about 1 in 5 breast cancers, but it's a wonderful emblem of what we are going to be doing in the future. That is, we're going to subtype cancers and treat those cancers by killing or inactivating what is making them grow. HER2-positive breast cancer is growing because it has too much HER2, which is a protein that stimulates the cells to grow, divide, and repair. We normally have about 20,000 copies of these on our cells, our breast cancer cells, but in HER2-positive breast cancer, there's 2 million to 2.5 million of these.
Wow.
It makes a cancer that is extraordinarily aggressive. It's like having a solar panel just telling that cell to grow and divide. So in 1998, when Dr. Dennis Slayman discovered and started treating patients with this anti-HER2 treatment, he found astounding benefit in improving the survival of patients who had spread or metastatic breast cancer. Thus, studies were done in early breast cancer when we started testing every single patient, not just for estrogen and progesterone receptor, meaning they would be sensitive to hormone therapies, but for HER2, meaning they would be susceptible to anti-HER2 therapies. And so anti-HER2 therapies are now a part of the standard of care. And we have not only anti-HER2, but also anti-HER3, which works with anti-HER2. Both of these work on the outside of the cell. Think of the cell like a sunny-side-up egg, which indeed is a single cell, and HER2 is like an iceberg that has a part sticking up outside the cell and a part sticking inside the cell. The HER2 and HER3 antibodies that we use, they work on the outside, but neratinib works on the inside. So even if the signal comes from the outside and gets inside, neratinib, because it works on the inside, can block that signal into the nucleus of the cell, which would be the yolk in the analogy, causing it to grow and divide. So neratinib offers our patients an entirely new way of working. Why is this important? Well, we thought we had it licked when we had the HER2 and HER3 figured out, but it turns out we still have 15%. That's like 1 in 7 patients who still have tumor come back, even though we've tried to block down HER2 and HER3. So neratinib can chip away at that in patients, it was found, who are HER2 positive, who get this pill within 1 year of completing their trastuzumab therapy, and very interestingly, in patients whose tumors are hormone receptor positive.
So it offers a lot more hope as far as recurrences of breast cancer, yeah?
Yes. And of course, it will also be tested and is being tested in spread breast cancer. Right now, spread breast cancer isn't curable, but HER2 positive spread breast cancer, that has one of the longest survivals. I treated a patient for almost 20 years with various anti-HER2 medicines in the spread setting because there are so many ways to thwart it if you can target the HER2.
So if there are so many ways that you can deal with it, what are some of the symptoms that you should be looking for before you're in such an advanced stage?
Of course, everyone knows that the most common symptom of breast cancer is a painless lump. But it doesn't have to be painless. It could be painful. Hopefully now, one of the most common symptoms of breast cancer is getting your screening mammogram and getting a call back. Hey, we found something very tiny. We need to check it out. Dang, it is a cancer. But we got it so early, you have lots of options, including lumpectomy. You don't need to have mastectomy. You might not even need chemotherapy. So those are the two most common things. But there are some uncommon ways that breast cancer can present. For example, it could be a lump in the armpit. Sometimes the breast may change its appearance. Sometimes the breast can get larger. There can be redness on the breast. And not to be confused, we all have undergarments, bras that may be too tight, and some days our breast is red when we've had a tight bra on. It's not that sort of redness. It's a redness that doesn't go away, and it's not related to a skin irritation. When cancers form that don't make tumors, per se, round balls, sometimes they infiltrate, like guerrilla soldiers in the jungle. They don't form a unit, but they infiltrate, and they can cause the breast to get an increased density, and they may even get into the skin lymph channels, causing a peculiar thickening of the skin called peau d'orange, which is French for peel of the orange. So you can see the pores. These are not very common, fortunately, but they are things to look for.
Are they uncommon across the board, or do they present as something common in, say, a different type of woman, younger or older, pre- or postmenopausal, or any of those factors that can make something uncommon become a common situation?
No, these are pretty much across the board. There are certain cancers that have a propensity to present one way. For example, there's a kind called lobular cancer, and that is, again, a different kind of cancer. When we think of the breast, there's really two major cells in the breast. One are the milk-forming cells, which are the lobules, and then we have the pipelines or the ducts that conduct it. 90% of cancers come from the ducts, but about 10% come from the lobules. And those are specialized cells. They're often hormone-positive, very hormone-positive, slow-growing, and they're the ones that like to infiltrate in this manner, causing the breast to become thicker or more dense, and they're a little more challenging to detect, but they're present in all women.
So where do you see, as a practitioner, the future of breast cancer treatment based on some of these new findings, especially when you thought you had it licked, then you realize you didn't, and now you're almost not back to square one, but it's back to the drawing board nevertheless?
Oh, it'll always be back to the drawing board. I think of breast cancer like one of those Russian dolls. You keep taking it apart, and there's another little doll inside. But the thing is, it's a smaller doll inside. And where are we going with this? We're going with precision identification of the drivers of these cancers. So HER2 was just the second one that we found, because the first one was found way back in the day, and I think it was in the 1890s. Beetson was one who discovered that certain tumors are fed by estrogen, and he started taking ovaries out, helping women. So that is a targeted therapy. Now we have the HER2 targeted therapy. And as we look more and more deeply into these cancers, many of them have different driver mutations. The triple-negative breast cancers that Angelina Jolie's mother had, and her grandmother had the ovarian, so we know that's caused by the gene mutation. So that's another area where we're looking at targets to prevent the breast cancer. And there are similar other genes that cause the cancer for which we are developing targets, either chemotherapies or immune therapies like Herceptin that are like Trojan horses. They're immune therapies that go to these proteins and carry chemotherapy drugs to kill only those tumor cells.
So some really exciting developments on the horizon. I'm glad that you came back and talked with us, giving us this update, and also bringing some more awareness to the availability of the recently FDA-approved NERLYNX treatment for early-stage HER2-positive breast cancer. Thank you so much for coming back, Dr. Frankie Ann Holmes.
Thank you so much for asking. Research cures cancer. Remember that.
Absolutely. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Visit our affiliates page at the platform and be sure and download the podcast on iTunes and SoundCloud.